Today we are going to discuss about jaundice. Jaundice is a common disorder of liver. It is characterized by yellow color of your skin, your eyes, or the sclera of the eyes or undersurface of your tongue. What are the causes of jaundice? Jaundice occurs when there is alteration in metabolism of bilirubin, when there is excess production of bilirubin that the liver can't handle, or when there is some disease of the liver, or when there is obstruction to the flow of the bile. Then these conditions cause jaundice. So jaundice can be divided into three types: prehepatic jaundice, hepatic jaundice, and post-hepatic jaundice. Prehepatic jaundice is because of abnormalities of your blood, that is excess breakage of red blood cells, which results in excess production of bilirubin, which the liver can't handle. This occurs in hemolytic anemias like hereditary spherocytosis, G6PD deficiencies, or some other autoimmune conditions which causes breakage of red blood cells. The second cause of jaundice is hepatic jaundice, that is the disorders of the liver. Because of the poor functioning of the liver, because of either an infection or an inflammation of the liver, or damage to the liver because of toxins such as alcohol or paracetamol, this causes mishandling of bilirubin by the liver. This increases bilirubin levels in the blood and causes jaundice. One more cause of jaundice is the post-hepatic jaundice, or we say it's a surgical jaundice. The jaundice occurs because there is obstruction to the flow of bile, either because of gallstones which block the flow of bile, or because of any tumors or any masses in the bile duct which block the flow of bile. This is called surgical jaundice because most of the methods used to treat this kind of jaundice are surgical. In which age groups jaundice occur? Jaundice can be seen in all age groups from infancy to late adulthood, even in geriatric population. In infants, the cause of jaundice are different. It can also be seen in pregnancy and young adults. How do you treat jaundice? So the first most important thing in treating jaundice is characterizing or diagnosing what is the cause of jaundice. Is it prehepatic, hepatic, or post-hepatic? If it's prehepatic, the cause of lysis of red blood cells must be treated. If it's hepatic, then depending upon what is causing the liver injury, that has to be treated, and all the toxic substances has to be cut down. And the post-hepatic jaundice, it's when there is flow of obstruction to the flow of bile. Either we can do an procedure, endoscopy procedure such as an ERCP, which by which we remove the stone, or if it's a tumor, we just put a stent there and will facilitate the flow of bile. This causes reduction in jaundice. The most important thing in treating jaundice is it has to be diagnosed early before considerable liver damage occurs. Once it's treated, a specialist consultation is required to plan the process of management. Thank you.